Hello, welcome to the Oregon Traditional Health Worker Overview. This is Module 3, and in this module we'll be looking at the role of policy and how it impacts traditional health work in Oregon. My name is Sarah Barron, and I have worked in community health roles, and I have been a part of Module 1 and Module 2. You've probably heard my voice in those modules. And now I'm going to be your guide in this final third module, the role of policy and how it impacts traditional health work in Oregon. We're going to be covering 3 goals. 1, examining how Medicaid and Medicare financing impacts traditional health work and supports it. We're going to look at how policies impact traditional health work. And finally, we're going to identify ways to be involved in the Traditional Health Worker Commission and what that is. 2024 Medicare billing codes have been updated to support community health integration, social determinants of health risk assessment, and principal illness navigation skills. These finalized services are aligned with the Department of Health and Human Services Social Determinants of Health Action Plan and help implement the Biden-Harris Cancer Moonshot goal of every American with cancer having access to covered patient navigation services. Specifically, we are, the United States healthcare system, are working to finalize pay separately for community health integration, social determinants of health risk assessment, and principal illness navigation services. And all of this is to really support bridging the services between the patient and healthcare services and navigating the system. Medicare is definitely one of the largest public health insurances in the United States, and this is a big step forward in trying to support traditional health work at the federal level. Medicaid financing, and as you remember, Medicaid aid is based on financial requirements, income levels, and is a public health insurance. Medicaid financing definitely impacts traditional health work, and it is supported across the United States. This is both a federal and state program providing public health insurance. Across the United States, not all community health work is reimbursed by Medicaid at the same level. For example, as of 2023, at least 15 states allow community health worker reimbursement, and this is constantly changing. And as of 2019, at least 39 states allow reimbursement of peer services. Doulas have various billing rates on both public and private sides. This varies by state and is based on legislation and Center for Medicaid and Medicare service agreements. So as you do traditional health work, community health work, peer support work, doula work, whatever it is as far as community health, it will vary from state to state. Within the state of Oregon, traditional health work has a registry, and this registry is that after a person is trained by an approved training in the state of Oregon, they are able to submit an application to Oregon Health Authority to be entered into this traditional health worker registry. This provides a Medicaid number that allows agencies and community-based organizations and healthcare agencies to bill Medicaid at various rates that depend on agreements based on each region. This is an image that really shows a graphic representation of how Medicaid funds support community health work at different levels across the United States. The states in purple allow community health workers to provide services through Medicaid. The states allowing indirect reimbursement for community health workers through managed care organizations are also highlighted. And the light green do not allow reimbursement of community health workers. So this really shows how this can vary from state to state. As I mentioned before, states really drive how Medicaid is provided and how it is reimbursed within each state. And states have legislation. Here are some examples of Oregon traditional health worker legislation. House Bill HB, Senate Bill SB. And as you'll see here, House Bill 3650 requires states to establish criteria, descriptions, education, training requirements for health workers, peers, personal health navigators, and other providers not regulated by the state. So this legislation sets some of the criteria within the state. Senate Bill 1580 requires utilizations of these workers in the healthcare system and in transforming it. And Health Bill 3407 in 2013 establishes the Traditional Health Worker Commission. The commission advises the Oregon Health Authority on traditional health worker policy and program issues. Continuing more on Oregon traditional health worker legislation, HB 2024 and what was passed in 2015 adds oral health training requirement for certification of all traditional health workers. So if you are trained as a traditional health worker, you will see that oral health training is a requirement and is included not in the hours of the training, but separate and needs to be submitted with the application when submitting to the state to be entered into the registry. House Bill 2304 adds peer support specialists and sub-worker types, family and youth support specialists, to the Traditional Health Worker Commission. State legislations are key in setting the regulations and the rules that guide and also inform reimbursement and policy making. Legislative mandates are put into rules. Within the state of Oregon, all laws and policies are recorded and moved into what is called Oregon Administrative Rules, ORS. Administrative rules. These are used to carry out the goals established by the laws and policies passed, statutes. ORS are not adopted by the Legislative Assembly, but they're still considered a law. And what's key is that Oregon Administrative Rules, you will see that they're referred to often when guiding traditional health worker policies and implementation and guiding the traditional health worker and what they're doing both at the grassroots level and at the state level. So you'll see this terminology often, ORS, Oregon Administrative Rules, and what is in the ORS really sets the guidelines and framework. As stated earlier, the Traditional Health Worker Commission was established by legislative law, and this commission advises and makes recommendations to the Oregon Health Authority on the development, implementation, and sustainability of the Traditional Health Worker Program overall. And it is used to ensure that the program remains responsive to the consumer and to the community health needs of the various communities that are throughout the state of Oregon. So within the state of Oregon, we have many different communities, and the Traditional Health Worker Commission is key in providing that voice. Traditional Health Worker Commission, 19 members are appointed by the Director of Oregon Health Authority to serve on the Traditional Health Worker Commission. And this is through an application process. 10 of these members must be traditional health workers, at least 6 of whom have been appointed from nominees provided by the Oregon Community Health Workers Association. And 9 members represent various medical organizations, community college workforce development, and other state entities. There are 3 committees: Training, Evaluation, Metrics, and Program Scoring, TEMPS for short, reviews and approves all the different training programs for the traditional health workers in the state of Oregon. Payment Model Subcommittee and System reviews the billing and payment of the traditional health workers in Oregon and looks at how that is going and provides feedback and input on the different forms of workable payment models for traditional health workers. The Systems Integration Subcommittee meets monthly on the same day as the Commission or around that time and reviews and discusses integration of the THWs into the healthcare system. And this is done by analyzing opportunities and barriers to employment and creating a strategic plan to improve the health equity of underserved populations. Strategies may include outreach, training, and education of CCOs and community-based organizations, monitoring and reporting on employment standards. Each of these subcommittees are working and meeting monthly between traditional health worker meetings. The traditional health worker meetings are public. These meetings are held, the meetings themselves are held the last day of the month on Monday from 1 p.m. to 3 p.m. via Zoom. And there are also opportunities where there will be meetings out in the community, but most of the time they're provided via Zoom. For more information, you can access the link via the handout or in the module, or search for the Traditional Health Worker Commission off the Oregon Health Authority's website. And here is a screenshot of the Traditional Health Worker Commission's website. In summary, Medicaid and Medicare can reimburse THW services, but varies across the states and even worker type. Legislation, such as laws, play a key role in recognizing the work and also supporting the workforce across Oregon. In Oregon, the Traditional Health Worker Commission guides policies and has working committees that support this traditional health work across the regions. The Traditional Health Worker Commission is open to the public and meets monthly. As a THW and/or public member, this is an opportunity to learn more about the valuable work of THWs in Oregon.